Good evening, ladies and gentlemen. Thank you so much for your audience. Thank you for being here tonight. This yet another day, another opportunity for us to learn about something that is very, very important in the society, because a lot of people come up with these conditions like peptic ulcer disease and do not know that it is actually treatable. So I remain my humble self, Dr. Drugs, and it's a pleasure to be presenting peptic ulcer disease treatment this evening, where I'm going to talk about how we're going to treat this disease condition. And once again, I say good evening and welcome. So the topic is peptic ulcer disease and treatment. And it's courtesy of the Health and Wealth team in collaboration with myself, Dr. Drugs. So our table of content goes thus. Today, we're going to talk about the human stomach, because we can't be talking about peptic ulcer disease without having an idea about what the stomach is. And then we have to define what peptic ulcer disease is, and we'll talk about its types, signs and symptoms, causes and risk factors, complications, diagnosis, epidemiology, the statistical occurrence, and then we'll talk about the challenges in the management of peptic ulcer disease. You see a lot of people coming up with this disease condition over and over again. In fact, people are even calling it my ulcer. It's now like it's their friend. They say my ulcer does this, like they're talking about a friend, because it's growing and coming. We're going to find out how we're going to put a stop to that. We'll talk about the challenges in management of peptic ulcer disease. Then we'll also talk about the prevention and treatment. We're not talking about prevention and management, or we're talking about treatment, because peptic ulcer disease is completely treatable. But there are some things happening around that a lot of us do not understand, and that's where we come in today. Then talk about the current ideal regimen for treatment of peptic ulcer disease by H Pylori, the importance of natural pharmaceuticals in prevention and management of peptic ulcer disease. In fact, treatment of peptic ulcer disease. So what's the human stomach like? It's a hollow muscular organ in the digestive or gastrointestinal tract that helps to break down food after chewing and swallowing by means of enzymes. These enzymes are just like catalysts. They help to increase the speed of breakdown, as well as what? Hydrochloric acid. Believe it or not, the hydrochloric acid found in our tummy can actually dissolve iron. It's so powerful. And take note of this, because that's going to give us a clear picture of what happens when people have peptic ulcer disease shortly. And there's a churning action. That means physical breakdown of food as a result of motion by the stomach via its muscles. Now, the wall of the stomach is protected by a lining. It's just like nylon, something that's going to prevent the stomach contents, that's the acid and the digestive enzymes, from getting to the parts under the stomach. Now, this is protecting. Now, the wall of the stomach is protected by a lining from its own digestive action called the gastric mucosa. Let's take note of this, because very soon we're going to understand that even the stomach has the capacity to digest itself. And that's why it's very important we listen and understand carefully, so we'll know why and how this condition propagates or gets worse. Now, peptic ulcer disease is simply a sore or break in the inner lining or the mucosa of the stomach, the beginning of the small intestine called the duodenal, or the lower part of the esophagus. Now, the mucosa is simply a moist tissue covered by a protective mucous layer that lines the gastrointestinal wall, and they serve as a barrier that helps protect it from its own digestive enzymes and acids. Do you know, have you ever wondered that why is it that when a lion eats an antelope or attacks an antelope or a prey, it also consumes the stomach of the prey, and the lion's stomach is able to consume or digest another animal's stomach, because the stomach has the capacity to digest itself. That's where a lot of problem comes in, when there's a break in that barrier that hinders the acid and the enzymes from breaking through the lining and dissolving the stomach that is beneath it. And that is the origin of peptic ulcer disease. So, what are the types of peptic ulcer disease? We have gastric ulcer, also known as stomach ulcer, which are open sores that occur on the mucosa lining of the stomach. We'll talk about this a bit more shortly. Now, duodenal ulcer is a sore or break on the mucosa lining of the first part of the small intestine. That's this part that just immediately after the tummy, the stomach. we have the beginning of the small intestine. It's just attached to it right here. And you can see, like in this picture here, you can see there's a sore in this person's stomach around that area. You can also see that there's also a sore in the gastric area or the stomach area itself. You can see that the lower the lower part of the esophagus, that's the esophageal area, can also have a sore as depicted in this picture. So you can see esophageal ulcer is a sore break in the esophageal mucosa lining and often occurs at the lower end, that's the lower third of the esophagus. Now, these sores may occur as a result of damage by what? Helicobacter pylori bacteria. This is the major cause of ulcer. So let's take note of this. And the effects of the stomach acid on affected areas, as well as excess acid secretion, as in cases of gastroesophageal reflux disease, also known as GERD, G-E-R-D. So, gastric ulcer is also known as stomach ulcer. It's a sore that develops on the lining of the stomach. It occurs when the lining of the stomach becomes damaged, allowing stomach acid to come in contact with the underlying what? Tissue. Just as aforementioned, causing pain and discomfort. It is often caused by who again? Helicobacter pylori. Now you can see this Helicobacter pylori chilling in somebody's stomach as if it has rented an apartment somewhere in Lekki, phase 1, and it's just enjoying itself and drilling holes all over this person's stomach, while the stomach is just wondering, what are you doing here? So we're going to find out how we're going to evict these unwanted tenants virtually and let people have their healing. Remember, if you look at this picture closely, you can see the holes that this Helicobacter pylori has drilled as if it's trying to open windows for itself. We'll talk about that shortly. These holes are actually quite dangerous, and we'll talk about why they are dangerous. So, what are the signs and symptoms? Pain. Stomach pain is often the first sign of peptic ulcer disease. It occurs after eating in gastric ulcer. That's how sometimes we just know that when people eat and they begin to feel that pain, we can easily tell that, okay, this is gastric. But before we even go for further assessment, we can give an idea of what's going on. And then before eating, as in duodenal ulcer, in fact, because the eating of food helps to reduce the pain of duodenal ulcer, it leads to what? Overweight. We'll talk about that shortly, because the patient will be eating more because it wants to calm the duodenal ulcer down. Now, it may be like a burning sensation or what? A sharp pain. Then we have stomach discomfort. We have anorexia, which is loss of appetite. Belching, that's gas emission, because these parasites are in the tummy and they are alive, and you know that they are going to be having some gaseous exchange for their own survival. Now, we have bloating, that sense of fullness because of the gaseous emission and all that, and the blockage associated with the damage to the gastrointestinal tract, blocking the food path. Then we have vomiting of blood, weight loss, as in gastric ulcer, because the patient will be avoiding food because you know that after eating it gets worse. Then it can cause weight gain, as in the case of duodenal ulcer, as aforementioned, because the patient will be taking food to quell the pain associated with the ulcer. And then there will be occult blood, as blood in stool. There's dark, terribly smelly, tarry stool called melena. That is also often noticed. Then, of course, insomnia, because who can sleep peacefully with a stomach on fire? So this is how Helicobacter pylori comes as a visitor, and then it finds its way into being an unwanted tenant, and before you know it, it wants to turn the owner of the stomach into the tenant because it doesn't want to leave. It basically starts by drilling this kind of tiny hole that may not be so serious. One may just be feeling some kind of pain once in a while, but unfortunately, this hole can lead, this erosion is actually called an erosion, can now finally lead to what? An ulcer. Now, if you take note of this hole, you will see directly beneath this hole, you can see an artery and a vein going their way, minding their business, until this hole can actually drill through and rupture an artery or a vein, and then you see the person vomiting blood, and then people begin to believe that is one of the patient's uncles in the village that wants to take the patient's life away because of one land or property in the village, not knowing that it's just peptic ulcer disease that is making the patient to vomit blood. That is how people begin to, find their way to the emergency room, because this thing can actually kill people, because where will you put your hand to stop the bleeding? And that is why this disease condition is so deadly and people should take it very seriously because I'm going to show us what it looks like. A lot of us don't even bother because we don't know what it looks like. I'll give us an idea of what it looks like. And when you see what it looks like, you know how serious the situation is. So these are factors that progressively damage the gastric mucosa lining and expose the stomach to damage from acids and enzymes during digestive processes. Ladies and gentlemen, I present to you the most dangerous actor or major role player in peptic ulcer disease. This guy that looks like Predator, like that movie that Arnold Schwarzenegger acted, the head of Predator, is actually Helicobacter pylori. These are the tentacles to which it anchors to the gastric mucosa and refuses to let go. If one is not careful, it begins to drill deep and can rupture or perforate the stomach wall. So it's responsible for over 90% of cases of peptic ulcer disease, and elimination of this bacteria is very important in eradication of peptic ulcer disease. So it's a bacteria that attaches itself to the mucosal lining of the gastrointestinal tract, damaging it and causing inflammation. Please, let's take note of this word, inflammation, and exposes the stomach wall to damage by acids and digestive juices, as aforementioned. It uses to digest food. Typical example is hydrochloric acid, pepsin. And in short, the stomach begins to what? Digest itself. You can see how they come around like visitors, and then they begin to call their brothers from the village to come and join. And then as they're having their meeting here, they finally find a way to begin to destroy the stomach lining on this side. That is how it goes. Okay. But be that as it may, we also have non-steroidal anti-inflammatory drugs. Unfortunately, a lot of people cannot do without these things because they have one condition or the other. And now these range from drugs that prevent blood clots, like those that are having atherosclerosis that has led or is leading to stroke or heart attack, to drugs used in chronic pain relievers, like those that are having lumbosacral spondylosis, those that are having osteoarthritis, all this. Some people are just chewing these things like chin-chin without thinking because they just want a quick fix. But unfortunately, that quick fix is nothing but a quick scam, because at the end of the day, the damage to the knee or to the lumbar region is still there. And the pain that is supposed to prevent people from leaning too much on that side is taken away by these pain relievers. And that's why these painkillers are also actually killers, because at the end of the day, they hinder production of biomolecules, prostaglandins that protect the gastric mucosa. So they are just taken to give immediate relief. So nobody should be expecting that after taking pain relievers that the problem has gone. But bear in mind that as we swallow pain relievers, a typical example is paracetamol. People chew like chin-chin all around. People take it like they're eating hobnobs. But this thing is actually hepatotoxic. It kills and damages the cells of the liver. In fact, it helps to shut down the liver. But that's why you hear 2 tablets 3 times a day for a maximum of 3 days. And if symptoms persist, consult your doctor. That shows you that that's a problem. Another thing again is that ibuprofen, aspirin, and a lot of them, diclofenac, these things can destroy the gastric mucosa. And you can see one of them actively drilling a hole in somebody's stomach here. You can see how serious it is doing its job. Somebody that's already having ulcer, this one is already carrying a drill and is helping to open more holes in the area. That's exactly what it does. So one has to be very careful. So let your health practitioner decide whether you are going to continue or stop this medication. Now, stress, also via cortisol, which is stress hormone, that's what described from that day, can also provoke peptic ulcer disease. Smoking directly is a problem from time, apart from the fact that it leads to hardening of the blood vessels that supply the gastric mucosa and allow them to function better. It makes the blood supply hindered in that area. Alcoholism, of course, causes peptic ulcer disease, and other diseases can also lead to peptic ulcer disease. This is what it looks like. You see, when we tell people that don't joke with peptic ulcer disease, because they can't see it. But looking at it now, this is an endoscopic view of what a lot of people are playing with. You can see that this person is already preparing for bleeding. That is how peptic ulcer disease starts. I wish people could see their stomach and they will not joke with this condition. And that's why it's important we are here to listen to how we can treat this condition. Now, take note that you see the ulcers around here. Anytime some people make with some patients take medication and they feel better, but when you don't take care of these holes that are being drilled around here, guess what? A homeless Helicobacter pylori bacteria that finds its way into that hole has already been given accommodation and you start communicating. So we have to discuss how are we going to make sure that these holes are what? Covered. So gastrointestinal bleeding may occur when blood vessels in the stomach wall below the mucosal lining are eroded. This could lead to what? Severe loss of blood, anemia, and death. The kind of death that people watch in Nigerian home videos and all this kind of where people vomit blood, that is the same type. There's no difference of the kind of death that happens when people are bleeding when it happens. It's so terrible. Perforation simply means that the Helicobacter pylori has successfully drilled through the mucosa and through the stomach wall, and now the content of the stomach can actually spill into the abdominal cavity. So a hole in the gastrointestinal or esophageal, stomach, and intestinal tract that may lead to spillage of stomach content into the abdomen, causing sharp pain and inflammation in the abdominal cavity. It is indeed a life-threatening condition. Obstruction is another problem because passage of food through the stomach due to scar tissue and inflammation again, take note of inflammation again, from PUD can lead to a sense of fullness, vomiting, and weight loss. That's why people that have ulcers sometimes, they don't have appetite and they keep throwing up and lose weight. This is exactly what it is. You can see the blockage here. The food cannot pass because the Helicobacter pylori has caused a lot of problem and damage here. Penetration is when it has successfully drilled through the stomach, but this time around is even drilling into another organ like the liver. But bear in mind, unfortunately, that there's a possibility of cancer up to 3 to 6 times more when there's a presence of Helicobacter pylori. So this is how it's diagnosed via endoscopy, as aforementioned. Antibody test via immune response. You check the blood to know whether some things that can tell us whether the Helicobacter pylori is there or not. Check it. Stool antigen test, that's evidence of presence as well. We can do biopsy. Sometimes we also do stool MCS to also, check for occult blood and all that. Urea breath test and all that. This is the epidemiology or statistical occurrence of PUD in Nigeria. About 5,846 deaths occurred in 2020 in Nigeria. So 5,846 people died of peptic ulcer disease. Just imagine. 2020. Okay, this part may seem like a comedy, but bear in mind that this is exactly how the Helicobacter pylori these days balances and waits for the antibiotics we want to. In fact, it's waiting for us, for patients to swallow antibiotics for it to just have his lunch, breakfast, or dinner. We're going to see why these things are not functioning the way they should. Drug resistance is when antibiotics that could have previously killed H. pylori bacterium are no longer effective. This is often as a result of, 1, wrong use of medication, Sabinus. When they are, I know my ulcer, I know how I handle it, and they start taking things that are wrong. And that is one problem, giving the Helicobacter pylori enough food to gym up and also, have, in fact, just telling them, relax. Don't worry, I'll get sleeping it for you so that your accommodation will be better. That's what they're just doing. And then you see, underuse of antibiotics will lead to superbugs because they will begin to get resistant and the mutation will begin to occur. So mutation is also a problem. So mutation to more difficult strains by bacteria called superbugs is also a problem. That's why you see some people are taking omeprazole, they're taking anorexia, clavulanic acid, they're taking tinidazole and everything, and the bacteria is just looking at them because you're having what? Superbugs. Of course, bad lifestyle choices like smoking, alcoholism, and a lot of other things, living a stressful life without rest can also lead to it. Then we have other health challenges like bleeding disorders. Some people can be having bleeding disorders like low vitamin K and all these issues. Some people can have arthritis, you understand, as aforementioned, because of the excessive use of NSAIDs, that's non-steroidal anti-inflammatory drugs. Diabetes is just a terrible thing in the sense that apart from the fact that it affects the blood vessel supply in that area, it also stresses the system, leads to an excess of free radicals that damage the DNA of those cells of the gastric mucosa, causing more problem, and can also cause, unbelievably, can also cause or worsen peptic ulcer disease. Then, of course, we're looking at the ulcer size and location, because an ulcer that is as big as the map of Nigeria would need more treatment, more attention than one that is as small as a pin head. Now, prevention and treatment of peptic ulcer disease, the first thing we're looking at is early detection. It's teaching time, saves life. One has to stop smoking, rest adequately, avoid alcoholism, stop provocative medication, like as aforementioned, the NSAIDS and all that. Surgery may have to be an option, because if the stomach wall is already perforated, rather than allow the contents of the stomach to spill, one may have to go for surgery. And the use of appropriate medication to kill H pylori, what I call chemical intervention, we'll talk about that shortly, because this is where a lot of people say, I'm taking my medicine for my ulcer, as if the ulcer is like a friend or a neighbor. But unfortunately, taking medicine just without taking the appropriate regimen is not good enough. Things have changed. In fact, and we'll see why shortly. And the use of natural pharmaceuticals for thorough eradication and healing of peptic ulcer disease. That is the way to go now. So let's talk about chemical intervention. This is what a lot of people are used to. These are designed to kill the parasite and make its habitat or dwelling place in the stomach inhabitable. We'll mention a few shortly. And they include proton pump inhibitors that reduce the amount of acid that is secreted into the tummy, to the stomach. We have the antibacterials. These ones, because Helicobacter pylori itself is actually a microorganism, so this is also essential. We have antiprotozoa that attacks the Helicobacter pylori as well. Then we have antacids too that help to neutralize the acid content in the stomach. So the above is actually called quadruple eradication therapy, because this is this gold standard these days. But unfortunately, it's often ineffective, as Helicobacter pylori is getting more resistant to it. Before, if you just take omeprazole, amoxicillin, clavulanic acid in a short while, just a few that you are okay. But now, it's not often good enough in many instances. Hence, after treatment, there's often recurrence of this terrible disease condition. It is strongly advised to use appropriate natural pharmaceuticals concomitantly. This is how I have been able to achieve 100% cure rate for Helicobacter pylori. So, what is the current ideal regimen for treatment of peptic ulcer disease caused by Helicobacter pylori? I just want to give us, I'm not saying this is what we should use. This is just an example of what your health practitioner may suggest to you. An example is to take the following natural pharmaceuticals for 1 month, as I've all listed here, and then to also take concomitantly with these chemical drugs, these ones that are here, that are listed there, all for 2 weeks. Then one has to check for H pylori, and if present, one has to repeat these chemical drugs for another 2 weeks while the natural pharmaceuticals are still running in the background. And that is how Helicobacter pylori is often treated. So that is not, I'm not saying that's what we should use, but you consult your health practitioner and he will tell you better about your own peculiar case, because no two people are the same in life. Now, how do these natural pharmaceuticals work? I'm dwelling on this because this is a part where a lot of people do not understand, because we are used to the chemical drugs and all that, but we don't hear much about the natural pharmaceuticals, and that's why I want to talk about it today. Now, they help to kill microorganisms that cause peptic ulcer disease. They help to boost the immune system against Helicobacter pylori. They weaken and destroy resistant strains of Helicobacter pylori. Can you see that? Seal up craters and sores in the mucosal lining. Remember, we're talking about that picture where we saw the actively bleeding gut as a result of Helicobacter pylori. Now, where bacteria can anchor, because they can anchor, and that can be a problem, because if they anchor into a crater, they have found a home, and that's a new problem waiting to cause another bout or round of peptic ulcer disease. They neutralize free radicals or reactive oxidation species that damage DNA, essential for production of protective biomolecules in line. Counter gastric hyperacidity, prevent recurrence of peptic ulcer disease, prevent inflammation. We talk about inflammation oftentimes, and they prevent damage and further damage and promote healing of the gastric mucosa, stomach lining. Now, I'm not saying that what I'm about to show next is exactly what you have to use, but this is what I use for my patients, and they have been having 100% recovery. So what I'm going to see next will be an example of the kind of natural pharmaceuticals that we can use in the treatment of peptic ulcer disease, especially caused by Helicobacter pylori. So a few examples include this. You can bring out your biro and pen and write down so you can go and make some further research. Now, bee propolis is a powerful natural antibiotic and antimicrobial, that's antibacterial, antifungal, antiviral, and it helps to kill Helicobacter pylori, the major cause of peptic ulcer disease, and also boost immune response against it. It's a bacteria, so the immune system can actually act against it as well. So let's take note of that. So propolis is a natural substance collected by bees which has several properties that can help against peptic ulcer disease. So let's just run through a few. That's anti-inflammatory action, it's antibacterial, has antioxidant properties to help protect damage caused by free radicals, it's soothing and protective, has immune system support, and it also helps to reduce the production of stomach acid, which can irritate or worsen ulcers. This product has been used for thousands of years because it has a very powerful adaptogenic quality. It's also known as the wonder plant, with an inexhaustible list of benefits to the human body, and has been used for thousands of years for various ailments and conditions. To mention a few in relation to peptic ulcer disease, contains the glucosamine, which enhances mucosal lining regeneration and healing, and enhances healthy blood circulation necessary to promote healthy mucosa. Because if the mucosa is healthy and intact, the acid will not be able to begin to consume the stomach beneath the gastric mucosa and cannot cause peptic ulcer disease. And it contains asemannan, which promotes white blood cells that fight bacteria. Remember, we talked about the immune system. Anthraquinones help with pain, we have antioxidants, and it's also an adaptogen. Hence, it's essential because of its rejuvenating property that helps to cover those holes and render any stray Helicobacter pylori homeless, hence mitigating the issue of recrudescence or recurrence. So it prevents new anchor points for Helicobacter pylori, and it also has anti-inflammatory and antibacterial properties. So more specifically, it has anti-inflammatory properties, soothing and protective effects, has antioxidant properties, immune system support. pH balancing means that it helps to keep the pH value of the stomach. That is, if the stomach has excessive acid in there, it helps to quell the excessive acidity and all that. And you can see that's just an example of what it looks like, but there's actually an inner core that is used, and it's often the Aloe barbadensis Miller that is the best of them all. And that is why it is very essential we take note. Not every aloe vera drink you meet around is made the proper way. So take note of that. The ones that have the core, the inner part that has been extracted carefully, like the one that I've shown, the example I've shown, the aloe vera gel by Forever Living Products, has the pure core. That's what it is. That's what is being used to produce it. And that's why it's very, very essential that we take note of the fact that we need to use the authentic thing to clear this disease condition, because it is very, very dangerous. Now, immune blend. This helps with immune response and white blood cells to combat Helicobacter pylori. It contains a combination of natural ingredients that can help against peptic ulcer disease in several ways, which include antioxidant properties. Of course, from the name, we know that it provides immune system support. So the ingredients like maitake and shiitake, which contain beta-glucans, can stimulate the immune system, which can help fight off H pylori infections that cause peptic ulcer disease. And the good news is that it contains vitamin D and zinc, which promote and support and strengthen the immune cells as well. Now, it has anti-inflammatory effects. You see, we're always talking about that because of the ingredients it contains, and of course, antibacterial properties. This product is so amazing. It's called Lycium Plus. It's a powerful antioxidant against free radicals and protects the mucosa from damage or further damage. It contains a blend of ingredients that help against peptic ulcer disease in several ways, which include: 1, reduce inflammation and oxidative stress, protect the mucosal lining of the stomach, and a lot more, courtesy of Lycium barbarium, also called Golgi berries. Then we have reishi mushroom, which contains beta-glucans and terpenes and polysaccharides, which enhance immune function, reduce inflammation, and more. We have glutamine, which is an amino acid that will help to heal and seal the gut lining, which is very, very important. We're talking about an ulcer, that's a break in the lining. Then it helps to reduce inflammation and oxidative stress, support immune function. Of course, that's vitamin C, which is an antioxidant, and all that. So these ingredients help to what? Alleviate peptic ulcer disease symptoms by basically reducing inflammation and oxidative stress and more. A lot of us hear about EPA and DHA, which are essential fatty acids given to children that have autism, given to people that have high blood pressure, given people that have high blood cholesterol, heart attack, and all that. This natural pharmaceutical has an inexhaustible list of functions. And you can see that it's also indicated in peptic ulcer disease. Because it contains omega-3 fatty acids such as eicosapentaenoic acid and docosahexaenoic acid, which are basically from fish oil, helps against peptic ulcer disease in several ways, which includes anti-inflammatory effects, mucosal protection, because they help to support the integrity of the mucous lining in the stomach and duodenum. Who knew that? And they reduce the risk of what? Ulceration. They have antioxidant properties because they help neutralize free radicals and reduce oxidative stress, protect the mucous lining from damage. We're also talking about this mucous lining because that is the key factor that once it's broken, peptic ulcer disease has commenced. And the immune system support is also amazing, and the antibacterial effect is also wonderful. But bear in mind that eicosapentaenoic acid and docosahexaenoic acid that are made from cold process are often the best or recommended because they have the best structure. The glycerol backbone is intact, unlike the ester backbone that is for commercial purposes. Now, we keep talking about good bacteria and bad bacteria. So we already know that Helicobacter pylori is what? A bad boy. It's a bad bacteria. And so we need good bacteria to actively compete against this bad bacteria. And this is how it happens. So because active Pro-B contains good bacteria of Bifidobacterium and Lactobacillus species in 6 different strains and up to 80 billion colony forming units. That's as you're taking one capsule, it is going there to provide or grow into more good bacteria, hence suppressing the effect of Helicobacter pylori. Now, bear in mind that the good bacteria are very important in the gastrointestinal tract for functions like boosting the immune system and production of what? Vitamin K. Vitamin K prevents bleeding, apart from the fact that it helps to remove calcium from other parts of the body back to the bones. That's why it's indicated as the K2. That's an analog of vitamin K. That's why you see that when you're giving treatment of arthritis, it is important that in extreme cases of arthritis, especially extreme cases of arthritis, even the lumbosacral spondylosis, osteoarthritis of the spine, and osteoarthritis of the knee, you see that, and others, we often add substances that help to promote vitamin K that translocates calcium from the body down to the bones and helps the joints to heal faster. So that's a topic for another day. So you can see the vitamin K has a very important role, which is that it helps to stop bleeding. That is why even women that have menorrhagia, I give them products that help to boost vitamin K, and before you know it, they say that they are feeling much better. That's a topic for another day. And then they also competitively outnumber and mitigate the effect of bad bacteria like Helicobacter pylori by secreting aseptic, propionic, and lactic acid. So they actively even attack Helicobacter pylori. That's why it's very important that they are part of this regimen. And as a bonus, they also hinder the bad bacteria, as aforementioned, that cause typhoid fever. Can you imagine? And paratyphi, typhoid fever via Salmonella typhi and paratyphi. Then more specifically, forever active Pro-B, a powerful probiotic, contains lactobacillus acidosis and bifidobacterial lactis that helps against peptic ulcer disease in several ways, which includes maintaining a healthy gut microbiome reduce Helicobacter pylori colonization, inhibits inflammatory responses. Of course, it helps reduce inflammation and swelling in the stomach and duodenum, alleviating symptoms of peptic ulcer disease, supports mucosal integrity, enhance the immune function. There's a very strong link between our gut health and our immune system. That's a topic for another day. Then reduces oxidative stress and supports what? Tissue repair. Now, we're talking about vitamin K. Now, here is something that contains vitamin K directly. And as a bonus, it also contains manganese and chromium for people that are having type 2 diabetes. That's a topic for another day as well. So fields of greens contains alfalfa that helps as a buffer, that helps to, keep acidity in check. Okay? Now, more specifically, it has anti-inflammatory effects, mucosal protection, antioxidant properties, immune system support, pH balancing that helps to keep the acidity, hyperacidity in check, as well as what? Prebiotic effects. We've talked about probiotics. Now we're talking about prebiotics are substances that enhance the microbiome, give them substrate or substance for them to grow on and multiply better. That's what we call them prebiotics. They help to boost the growth of good bacteria. You can see we have probiotic and we have prebiotics. Probiotics are the ones that are the live bacteria, that are the good bacteria that we ingest, and the prebiotics are the ones that help to promote the good bacteria. Now we have a product from the beehive called bee pollen. It contains a blend of bee pollen, vitamins and minerals. But who knew that it has anti-inflammatory effects, antioxidant properties, immune system support, soothing effects, helps with pH balancing and keeps hyperacidity in check, has prebiotic effect as I've described, and it also has antibacterial effect. These are things a lot of people do not even know about. But when we begin to go and research into these things deeper, we find that they really help with regards to treatment of peptic ulcer disease caused by Helicobacter pylori. So let us kindly note that we do not adjust medication and dosage without the guidance of what? A trained health practitioner. Remember that no two people are the same. Someone may be feeling a pain around the chest region and may be having angina pectoris, which is secondary to myocardial infarction or heart attack. It's a different thing entirely. So if one begins to decide to treat himself, you may be treating peptic ulcer disease instead of taking care of issues that have to do with hypercholesterolemia or atherosclerosis that can block the blood vessels of the heart. So you see, so we must have to always be under the guidance of a trained health practitioner. So before I leave us, I want to leave us with this. Let's bear in mind that what you are what you consume, and there is indeed a constant battle between factors that repair and protect our bodies and what? Those that break it down. So all we need to do is to what? Be on the winning side. So remember that peptic ulcer disease is completely treatable. I'm not talking about management here. It all depends on how you are going about it. And so I strongly suggest that everyone should be on what? The winning side. So on this note, I will say thank you so much for coming and listening, sharing to your friends to come and join. Say remain blessed and good night.